and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. Pathology is the scientific study of diseases. Some countries have and are still publishing works detailing findings about COVID-19, even while the pandemic rages. Many are able to do this by closely observing those the disease has struck and those it has killed. This has led to the formulation of several candidate vaccines in clinical and preclinical evaluation stages. Let's get some of our numbers now. By July the 11th, there were over 12.5 million confirmed cases of COVID-19 all over the world. Recoveries had risen to more than 6.8 million people, and there were over 560,000 deaths. The US is still the global epicenter of the pandemic, with over 3 million cases and about 25% of the world's burden. In Nigeria, there were over 31,000 confirmed cases of COVID-19, over 12,000 recoveries, and 709 deaths. My guest is a professor in forensic pathology, one-time medical examiner to Lagos State, and a former vice-chancellor of Lagos State University, Professor John Oladapo Obafunwa. You're welcome to the show, sir.
Good afternoon, ma'am.
So, when people are studying, at least what I've seen from TV and some other things, they want to study a disease, they want to know what killed this person, they do an autopsy. How does an autopsy make you understand a disease?
Well, let me start by referring to what you said earlier on, that pathology is the study of the disease. There are different branches of pathology. You have those of us who are in anatomic pathology, where our job involves autopsies.
Okay.
You also have other pathologists who are into infectious agents.
Oh.
That's microbiology. You have those who deal with blood diseases and blood transfusion. Those are the hematologists, and those who deal with altered levels of chemicals in the body, the chemical pathologists. With regards to anatomic pathology, part of what we do are the autopsies. Of course, we also deal with the living.
Of course.
The basis for, or the reason for autopsy is to be able to identify the cause of death. By so doing, you are able to educate the clinician, your colleagues in the clinic, so as treating the patients, what might have gone wrong,
Okay.
why the patient died, so that we can learn from it and treat the next patient better. Of course, that's just one aspect of anatomic pathology. Now, also related to autopsies is the area of forensic pathology, where you're not only interested in what caused the death, but how was it caused,
Okay.
what time it happened, who did what. It's more of an investigative
Very
thing.
detailed.
Right. That's another aspect of forensic, another aspect of autopsy pathology.
Okay, so some countries have studied people who have had COVID-19. Some are living, some have passed on. Do you know any of these discoveries?
Countries like China, Italy, Germany, even the UK, the US, they've all been involved in autopsies of COVID-19 cases. And that has given us some insight into the nature of what we are dealing with. In the course of doing that, we found that part of the problem has to do with certain alterations in the blood, increased clotting.
Clotting. Okay.
And that occurs in many blood vessels around the body.
Clotting, that gives an implication for blockage.
Blockage, right. And Because of that, in very severe cases, you end up with multiple organ failure because of the damage to the various organs.
Okay.
In the lungs, for example, where you have one of the manifestations, you have involvement of the blood vessels, you have destruction of the epithelial lining. These are the cells lining the air spaces in the lungs. Some of them are shed off, but in addition, you also have fluid accumulating in the lungs. You have a kind of membrane coating and making it difficult for oxygen to pass into blood and for carbon monoxide to come out. This has been observed in many cases that we have in some of the developed countries. And that was why initially it was thought that the problem was more of a lung pathology.
That's why all the ventilators.
All the ventilators that were being mass produced.
But are those ventilators needed as much as we thought?
No, because we now know better that part of the main problem has to do with disorganization within the blood system. Disorganizations involving the inflammatory response.
Okay, so you've mentioned inflammation too.
Okay.
Apart from blockages. Are they different? Is it the same thing?
Is the inflammation that results in the clotting. Okay. You have various factors being involved. For example, you have some cells being present in the lining of the wall of the blood vessels. They become, their activity becomes exaggerated.
Okay, so let me go out on a limb here and ask you, based on this, would doctors say that it's better, rather than using a ventilator, to use something like prednisolone, something that would bring down inflammation?
Good. Of course, it's a function of the stage in which you are catching the patient.
Okay.
The use of prednisolone is born out of the fact that you want to suppress the level of inflammatory response. And that's why that is being used. In addition, you have what we call the low molecular weight heparin, which helps to prevent clotting or break down clotted blood.
Okay, so a blood thinner.
A blood thinner. In that group, you also have the likes of aspirin.
Okay.
So these are things...
So this is important in treating COVID-19 then?
Important in treating COVID-19, apart from trying to use antiviral drugs. And if you did not have the benefit of examining the various organs at autopsy... Posthumously, you would not be able to better manage these cases.
Do we do that here? Are we doing any autopsies?
Oh, yes. We're doing autopsies here in Nigeria. Of course, we have the coroner's law, which for a long time was not being operated. But luckily in Lagos State, we had the coroner's systems law of 2007. And that helped us to identify the reportable deaths.
Okay.
At the peak of it, we were doing close to 3,000 autopsies a year.
Ooh.
Right now, in my department, we do an average of about 800 autopsies in a year. The rate has gone down, and that has to do with the poor implementation of the law. Of course,
the law was implemented before. Why does it go down? Why not continue at the same rate or even get better?
It's multifactorial. By the way, that has nothing to do with my department.
Okay.
That's a problem between the police, the system, the judiciary, and all the rest. I want to stay out of that.
Does it have anything to do with people's people's religious beliefs, their sentiments that, they don't want their bodies decapitated, so to speak, or a knife put to their bodies because of their religious beliefs?
Okay. Before I address that issue, I want to say that my department has the highest autopsy rate in the whole country.
Okay.
Like I said, we deal with about 800 autopsies a year. The nearest center will probably do about 80 autopsies a year.
For a country this big?
Right.
That's not
Now,
much.
it's unfortunate that you also have some anatomic pathologists who would not like to do autopsies.
Okay.
I will leave that for now.
Okay.
But I can tell you that I do not know of any religious book or teaching that says, I've not seen it in any religious book that says thou shalt not do an autopsy. When I was training in forensic pathology, I had classmates from Saudi Arabia, Egypt, Pakistan, Malaysia, just name it. The only thing is that you want to do it quickly. And that was why...
And you want to probably assemble the parts?
Oh, yes.
To make it look...
We do a neat job. In fact, the kind of cuts that we make on the body, if you lie the body in state, you won't see any evidence of an autopsy. You do the autopsy with a lot of respect for the body. Okay. And you don't just cut things as if you're a butcher and throw them. Even a butcher does a good job. But I can tell you that we do something much better. So autopsies are done in this country. And
are they routinely done, though? Of course, I know 800 a year, it means they're not routinely done. But is it supposed to be routinely done? As in, must there be a strange circumstance to the person's death, or is it just a routine thing that somebody dies and you do an autopsy?
No. Autopsies are done under specific circumstances.
Okay.
Going by the Lagos State Coroner Systems Law of 2007, we have a number of reportable deaths where the doctor on the ward says, I don't know what killed the patient.
Okay.
Where you have an accident, drowning, where you suspect poisoning, deaths following childbirth or associated with childbirth, sudden infant death syndrome in children, industrial deaths, regardless of the circumstances, deaths following medical intervention. When I say medical, I'm talking, the best example I can give you is somebody dying on the operating table.
Yeah.
Death following anesthesia. These are examples of cases. It's not that you have to do autopsies in all cases. If it falls,
but it's called for in these kind of circumstances. So how about COVID-19, a disease that is little known? How do you treat that?
That's the more reason why we need to do autopsies. A lot has been said about the manifestation of COVID in our environment, and that the disease is probably not of the same dimension. But how do you know it if you don't do the autopsy to see what changes you have? They talk about comorbidities, hypertension, diabetes. And if you do an autopsy, you'll be able to see these things and better advise those managing the patient as to what should be done.
So now, why are we not doing more of those since COVID-19 is on the loose?
All the cases that I've given example and talking about reportable deaths, you can do them in the average autopsy facility, autopsy room. Again, I can say with all humility that we probably have the best autopsy facility in the country, in my department. But be that as may, that is not the kind of autopsy room you want to use for a hazardous...
a pathogen like that.
A pathogen like that.
We will take a short break and take it up from here as soon as we come back. Please stay with us. When we come back, we continue from here. Welcome back. Call 0808-054-2233 if you have questions about pathologies, autopsies, and COVID-19. You can also tweet at CTV_Mary A. We were talking about the facilities that are necessary for an autopsy of this dimension, a deadly pathogen, so to speak.
Essentially, you need what we refer to as a BSL-3 autopsy suite. This is an autopsy suite where, number one, it allows for limited number of participants, between 3 and 4 at the most. It's under negative pressure,
Okay.
because you don't want any aerosolized pathogen to escape into the surrounding corridor, not to even talk about the external environment. You want to limit the infection of the pathology personnel as well. Such a facility, again, the doors are automatic. They interlock the moment you come in. And once you come in, you have no reason to go out. The air exchange within the facility, it's about 12 exchanges in an hour.
It keeps changing the air?
Yeah, you have to keep changing the air because the ventilation and also the illumination has to be perfect.
And we don't have this kind of facility.
We don't have it.
In the country.
Not to talk about the fact that you need proper decontamination room attached to it. The flooring has to be specific. The drainage has to be, because again, you have to treat the effluent.
That is very, very technical.
And the air that is going out must be purified.
I want to quickly ask, if it's so important for you to take a knife to a body to find out how a disease has affected the organs and what could possibly be the reason for the person's demise, what does a verbal autopsy do, the kind of which was done in Kano?
I consider that a very sad experience. Verbal autopsy, they talk about it. Of course, people will say, well, it's WHO recommended. Okay. But we're talking about remote areas, developing countries where you don't have the facilities. That is not Nigeria. And I detest somebody saying to me that you need to operate with the basic minimum, because I know in their environment, whether it's UK, Canada, US, or wherever, Europe, nobody will do verbal autopsy. There are limitations. And to start with, even where a patient has been treated in the hospital, under the care of the doctors, and they lose the patient, they write a death certificate. If we have cause to do an autopsy on the same body, it's not uncommon to find discordance. This is where a patient was actually treated in hospital.
Okay.
So you can imagine the level of discordance that you will get when you talk about verbal autopsy.
So they just talk about what happened, how the person felt, or what?
They send people out, not necessarily doctors to start with.
Oh.
Not even pathologists, of course, to interview the relations, the head of the family, or perhaps at best the spouse, asking questions. I saw the report of the Kano verbal autopsy, which was, I think, was on the 16th of June. 3 parameters were being concentrated on: fever, cough, shortness of breath.
And that could be something other than COVID-19.
Period. You can have that in heart failure. You can have that in asthma. You can have that in tuberculosis.
Okay, having explained this now, is it possible ever to attribute a death to COVID-19 wrongly just because there was no autopsy?
Very possible. Very possible, because don't forget that even now, There's been complaints about people going to the hospital, not being attended
But
to.
how about the tests they do, the swabs they take and test under the microscope?
No test under the microscope.
No test.
They take the swab, they look for the antigen, and try to make the diagnosis.
Shouldn't that be conclusive enough?
Well, again, it's a function of the stage. But having said that, it's not uncommon to have somebody with a disease that is not necessarily COVID going to the hospital, but not being attended to. People have been complaining about that, and they've been talking about people dying of some other conditions apart from COVID.
However, if somebody goes to the hospital and is tested properly, the swabs are taken, the samples are tested, can it not be conclusively, can they not come to that conclusive and right decision or diagnosis that this is COVID-19?
Yes, they can. But don't forget that presently the tests that are being done will still take about 48 hours at the minimum for a report to come. The patient has to be attended to in the interim, and that's why you have a lot of symptomatic treatment going on.
But that's why they take the swabs first.
Yeah, they take the swab first. But the question is, even where you have confirmed it and the patient is in the isolation center, are we doing enough blood work?
Okay.
Are we checking various parameters on a daily basis and monitoring the patient? You and I would have had people coming out and saying that they were just there, eating, nothing being
Has
given
our
to them.
focus changed, though, since people have studied these things and found out that it's not necessarily just a lung problem, but a clotting problem? Are we doing things better now when we treat some of our cases?
To a large extent, yes, and particularly in those other societies. Yes, we tend to give them the same medications in our environment, at least to some extent. But what are the peculiarities of our environment? We don't know.
That is a very strong point.
We don't know. So it's more of symptomatic treatment up to this point. And I want to believe that the magnitude of the problem is far greater than what we're being told.
And autopsies would help us to find that magnitude.
Autopsy will go a long way.
Thank you so much, Professor Bafunwa, for coming to the show. We've come to the end of it. I loved every minute of it. And thank you so much for listening and watching the show. Now, if you have any of those symptoms, you still must go to the hospital. You can call any of these numbers. You can call the toll-free number. And if you live in Lagos, call any of these other numbers, which are about to show on the screen. That's if you live in Lagos, call any of those numbers. Please feel free at any time to go to channelstv.com/podcasts to enjoy an audio version of the program if you missed it, if you are commuting, or if you want to listen all over again. Thanks for watching. Have a wonderful day. I am Mary Alale Yusuf.